you think that you're going to be happy when you achieve something, when you get to that goal. Like, for example, I became an attending. I thought I was the top of the world. After a while, then what? It wasn't as exciting and happy as I thought it would be. So the thing is that you can actually be happy now. And, yes, you're going through a lot of things, a lot of transitions, but it is the process that you're going through the most to get to where you want to be. Mm-hmm. So it's available to you to be enjoying the process.
Welcome to the Prospective Doctor Podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello there. This is Dr. Erkeda here with another fantastic guest, Dr. Mary Leung. I'm just going to give her an opportunity to tell us a little bit about yourself and your journey to medicine.
Hi, everybody. Nice to meet you all. So I think I started when I was a really young girl. My parents are both physicians. They are retired now, but when I was growing up, they were just, very passionate about their career. And they would talk about the patients and during dinner time. And I was just thinking, well, I wanted to help people. That was just the simple mission that I wanted for myself. So naturally, it just seemed like, being a doctor was the thing to do. They never, my parents never really forced me to do anything. In fact, my other siblings are not in medicine. So it was just kind of became a natural thing for me to become a doctor. And I find science very fascinating and makes sense. And so it's kind of, I guess, a somewhat straightforward and not super exciting path to go into medicine. I mean, I guess the exciting thing was I grew up in Hong Kong, and my parents sent me here for schooling after after 11th grade. So here I am.
That's an awesome story. And I think that a lot of people think that their stories aren't very fascinating and things like that, but everyone's story is special, and there are a lot of physicians now and future physicians who were inspired by the first people who could kind of shape you and touch you, your parents. So that's awesome that they were able to influence you to want to serve others. And when you decided to get through medical school, you settled on the specialty of HEMONC. What inspired that? And what advice do you have for students who may be interested in HEMONC?
Yeah. So I think it's just a little backtrack a little bit before the HEMONC decision is when I was finishing up medical school, just applying for a residency program, I was almost pretty set on just doing internal medicine. And I always thought that I would subspecialize in something. The decision of being in internal medicine was that I really enjoyed the human connection of and also the continuity of patients. I like to really know about the patients and not just their diseases, and just the really more personable touch to it, and that I will know them over time. So that got me into internal medicine. So as time went on, I was quite interested in hematology, actually, because I like the little bit of detective work. Sometimes, for hematology, is that when you look underneath a microscope, you immediately know the diagnosis of the patient. And so I thought that was, pretty exciting. And it just happened that a lot of the programs, pretty much most of the programs in United States is hematology and medical oncology combined, 3-year fellowship. So at the same time is that I actually enjoyed taking care of oncology patients because it's kind of the same idea that, I really wanted to be part of their journey of their cancer diagnosis. It's a chronic illness, and I wanted to be part of it to help the patients, their family, and not really just to take care, giving them chemotherapy or whatever treatment they need, but also be able to, facilitate whatever they need psychosocially, emotionally. So I feel like in, Hem-Onc, I'm able to do the more comprehensive approach in healthcare.
I love that. And that's a great story, because a lot of times when people are choosing their specialty, it's a hard decision. So choosing internal medicine and knowing that you want to go and subspecialize and specialize, and then figuring out like, okay, what's next? What do I love? What resonates with me? And I love how you compared it to being like an investigator or a detective, like looking under the microscope and being like, those cells look abnormal. So yeah. I love that story. So we all enter medicine with our hopes and our dreams and wanting to serve our patients and wanting to be those detectives and figure out those clinical diagnoses and mysteries. And then there's a lot of talk of that dreaded word that people who are a little bit further in their careers and sometimes earlier in their careers experience, called burnout. So now students are even experiencing that. And I think that sometimes attendings or other people may be like, it's too early in your career to be burnt out. Wait until this. But that's not okay. And your feelings are valid. Like, is there any advice for people that may be experiencing burnout regardless of what stage they're in life?
Sure. And I think you're right. I think any stage in life, even outside of medicine, anyone can experience burnout to, some degree. And basically, what burnout is that, you feel exhausted, you feel drained, and it can be physically, emotionally, and spiritually. Like you feel like, you're at the stage of how long can I last? How long can I go on feeling like this? You're basically running on dry fuel. Like, your tank is getting to empty or actually beyond empty. And so, you started to be, say, more cynical at work or in school. You start to vent about, the whole work or school situation. And so at this point, you're really not very emotionally available for your patients or for your family or friends. And at the same time is that you feel like, what is the meaning of all this? Why am I doing this work? It's like you kind of lost sight of why you go into medicine in the first place. So these are really all, signs and symptoms of burnout. So if you have any degree of it, it doesn't have to be the extreme case, but just a little bit of it, then you're probably, in the path of getting burned out. So, what we can do to help is to recognize it, is to be aware that it is happening to you. And when that happens, is just notice that you're human. It's not your fault. It's just something that can happen. And, what we can do about it is sometimes we may have to just take a step back and say, okay, what is causing me to feel the way that I feel, is it because of the workload, the long hours, or certain professors, or, any of those reasons? And is it because of how I view the situation? Is there any other way to, or any other perspective to view it? So that's one of the things. The other thing is really to pay attention to how we can take care of ourselves. And I'll talk about that in a second, more detail. I think one of the things that I discovered, and because I myself went through burnout and beyond burnout for quite a few years without realizing what it was, is that one big thing is, really life coaching helps. What coaching is that the coach helps you realize who you are, what you're experiencing, and that the coach guides you in terms of how you should do things and what to do, because ultimately you're the person who knows the best about yourself, but sometimes you may just need someone to point it out and also point out some of the perspectives that you can, look at things. So I think, these are kind of like a super overview of some of the ways to really decrease the burnout and increase the quality of life and job satisfaction.
I love those pointing out, because I think a lot of times people get lost in the day-to-day and they're like, well, this is where I am. Like, I can't change my professors. I can't change that I'm overwhelmed with studying. I can't change my schedule that doesn't necessarily belong to me when I'm a third and fourth year. But I love that you brought up that you can kind of take a step back and try to figure out, like, what is it that is causing your distress? And then how can you go about it? Yes, you can't skip all of your rotations for your whole surgical elective, because you have to go, but figuring out ways to help you get through the day. And sometimes you can use an outside source, such as a coach, just like they use in sports. They're here to help you win and help you kind of strategize your steps to get to the next level. So definitely looking into coaching, definitely taking that self-inventory and reflection and being honest with yourself.
Exactly. And I think that really awareness is the first step to realize that, hey, I may need some help, or maybe I need some, take a break or get some rest. Absolutely.
So we just chatted a little bit about the dreaded word burnout and how it can start earlier and earlier. And sometimes it can come and go and ebb and flow in the different ways. And sometimes you just have to kind of figure out a way to rejuvenate yourself. Now I want us to chat about something a little different. So a lot of students right now are preparing for the match that's out in March. For those who may be listening after March, congratulations. But life is always in a state of transition. So those who are in pre-med will be transitioning to medical school. Those who are in medical school will be transitioning to residency, and so on and so forth, with residents transitioning to being and attending. So there's always some state of what's next. And there's a thing called Arrival Fallacy. I want us to kind of chat about what that is and what's the difference between that and imposter syndrome.
Sure. So arrival fallacy, let's talk about that first. It is basically that you think that you're going to be happy when you achieve something, when you get to that goal. Like, for example, in pre-meds, I'll be so happy or excited when I get into medical school. Or I'll be, so happy when I get to the residency program of my dreams. So that's kind of the arrival fallacy. It's like you can only be happy when you get to your goal. So, but the thing is that when you get there, then you'll be like, oh, I'm here. Now what? Do I have to get to the next goal to be happy again? Because this type of happiness only lasts you a little bit. And I'm also speaking from, firsthand experience that, I got into the medical school, that's great. And then now what? Going through life. And then the residency program, fellowship program, same thing. It's like, and attending too. I became an attending. I thought I was the top of the world. After a while, then what? It wasn't as exciting and happy as I thought it would be. So the thing is that you can actually be happy now. And, yes, you're going through a lot of things, a lot of transitions, but it is the process that you're going through the most to get to where you want to be. So it's available to you to be enjoying the process. And, because I always believe that whatever hardship that you're going through, whatever negative things there are, there's always something positive. And you can be realistic and be positive about things. And that's what I tell my cancer patients too, that, just focus on things, and you can be happy now. If you have to go through the same process to achieve your goal, why be miserable when you can be happy? So I encourage students, residents, and, whoever is listening, is really, find the happiness now while you're doing the thing and while you're being present, rather than relying on the external source in the future to be happy.
I love that advice. Like, it's all about being present. Like, why not be happy today? You can be joyful in every experience or find the good in every experience, even though some may be hard. Sometimes in hindsight, you might look back and everyone's like, oh my goodness, I can't wait to be a third year when I'm in clinic. I can't wait to be a resident. I can't wait to be this. And you might look back fondly and be like, I think I kind of missed the past. So enjoy the moments while you're in it. Not saying that it can't get better and better and better, but you're in a good spot now, more than likely. And if you're not, you can utilize your resources to figure out how to get to that good spot.
Yeah. And to answer the second part of your question about imposter syndrome. So imposter syndrome is a thing that happens fairly commonly, especially in high achieving individuals. So, of course, pre-med students, med students, residency, even attendings, happen a lot. You may feel like whatever you have achieved, whatever success or recognition that you have, it's that you don't deserve those things. You feel almost like a fraud, even though you have done all those things. So, you're basically, this is stemming from you doubting yourself. The self-doubt is there, that you don't think that, all these things, it's almost like too good to be true. And so that happens a lot. And again, it's important to recognize what it is and what you're experiencing it. And if that happens to you, again, it's not your fault. Nothing has gone wrong. It's just how our brain is feeding us, and almost like a default thinking in a sense. So if you notice that is happening to you, just take a step back again and have compassion for yourself. Be kind, and just notice how you're talking to yourself, and ask yourself, the way that you're talking to yourself, is that the same tone or same words that you would talk to someone that you love, that you care about? A lot of times that may be no. And just really realize that hey, you can be a lot kinder to yourself and give yourself a lot of credit. I mean, you've gone through a lot to get into college, to get into pre-med and med school residency, and all these really, take a lot of hard work and effort to do it. So, and you deserve all these things that you have.
Absolutely. I couldn't agree more. I feel like you've shared so many pearls of wisdom with us. I hope that all of the students were taking notes. My final question for you is, if you could go back to when you were becoming a medical student, like in the beginning of your medical career, is there a piece of advice that you either did get from someone and you wish that you want to share it with others, or that you wish that you had gotten?
I think, one of the things that actually in life in general is that important to prioritize ourselves. That's something that I did not learn, and I learned it not too long ago. And I think it's important in really any step of our career or our, schooling, that because if we don't care about ourselves, then we don't have the capacity really, or the adequate capacity to care for others. And especially in the field that we're in medicine, we always, want to take good care of our patients. And the thing is we think of our patients first rather than thinking of ourselves. But, remember when we're on the airplane, when they talk to us, it's like, you put on your own oxygen mask before taking care of other people's, oxygen masks. So it's the same thing is we got to take good care of ourselves, give ourselves compassion, be kind to ourselves, love ourselves, and have that fuel to be able to take care of other patients, your family, your friends completely, fully, without any reservations or without any negative tank fuel, because otherwise is, no matter how much you want to give, we cannot give what we don't have.
Absolutely.
So I think that would be the, one piece of advice I would offer.
I love that. You can't fill up someone else's cup if your cup is empty. So keep refilling your cup. I love all of the things that you've shared with us today, and I'm sure that the students have learned a lot. How can listeners reach out to you for any questions or for coaching or anything like that?
Yeah, so because I feel like coaching has helped me so much that, yes, I'm a full-time hem-onc attending, but I actually have time to be coaching physicians also. And to reach me is you can email me at shiningwithgratitudemd@gmail.com, or you can visit my website at www.shiningwithgratitudemd.com. I'm also on Facebook with Mary Leung and LinkedIn Mary Leung MD.
Perfect. Thank you so much for joining us today. And for all of the listeners out there, click that subscribe button. Be sure to take some time for yourself. Be sure to share this with your classmates and colleagues, because it's very important things. Like, you guys are going out there to help the world. So got to focus on you too.
Thank you for having me today.
It was a pleasure. Bye, guys.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.